The fourth dangerous trend for men and women in midlife is the development of high blood pressure. It is the number one diagnosis for which individuals see doctors in offices. 31% of Americans have high blood pressure. And these are just some charts that document that it's 31% of office visits. This one says 27%. You can see on office visits what people go visit their general practitioner for, or their primary care physician. High blood pressure is the number one cause. Joint pain is the number two cause. Then you have diabetes, and depression is the number 3 and 4 causes of office visits. What causes high blood pressure? Obesity and being overweight, hormonal decline and imbalance, low serum magnesium. Great book, The High Blood Pressure Hoax by Sherry Rogers. If you can get a hold of any of her books, Sherry Rogers, go to her website. Sherry Rogers wrote The High Blood Pressure Hoax. Doesn't mean people don't have high blood pressure, but it's the way they treat it. The cholesterol hoax. And is your cardiologist killing you? These books are really, really, really important read for each one of you all to understand the benefits of vitamin and mineral support in your daily regimen to help you and help prevent you from getting problems with heart disease and high blood pressure and being overweight and diabetes and other problems. Low serum magnesium and low vitamin D lead to high blood pressure. You know what magnesium relaxes smooth muscles. Our arteries have muscles around them. They're lined with arteries. And when we don't have enough magnesium, they tighten down. And blood pressure is simply the force of the blood within the blood vessels caused by two things. The pumping of the heart, when it contracts and pumps, that's called systole, and that forces the blood from the heart into the blood channels, into the arteries. The resistance of the arteries, how relaxed or how constricted they are, determines the other part of the blood pressure. So if they're very tight and restricted, the blood pressure goes up. Well, as it turns out, the most common cause of having arteries that are constricted and not relaxed is not having enough magnesium. And 95% of the people in this room, unless you're taking magnesium, have low magnesium. And blood pressure is very simply treated with magnesium first. It'll be the first line of treatment. But you know what the first line of treatment is by conventional doctors? It's diuretics, hydrochlorothiazide. Well, guess what hydrochlorothiazide causes you to excrete in your urine? Magnesium. So you get on hydrochlorothiazide or a diuretic, and you lose magnesium and potassium, both of which relax smooth muscles in the arteries, and your blood pressure goes up. So you go back, 3 months later, and the doctor goes, your blood pressure is no better. In fact, it's worse. Now we're going to have to put you on a beta blocker or calcium channel blocker, or have to put you on ACE inhibitor, which have a whole host of problems, when they really should check your red blood cell magnesium, or do as we do. We start all our folks on magnesium here. And once you get your weight down, get your magnesium levels back up, guess what? Blood pressure comes down very normally, safely, and naturally, and without any side effects. Poor nutrition, trans fatty acids. We talked about that earlier. Will lead to development of high blood pressure. Food allergies can cause high blood pressure. Food allergies, the very food we eat. It was said by Hippocrates, let food be your medicine, or let medicine be your food. And there was another saying, one man's meat can be another man's poison. There are certain foods that we eat if we have an allergic diathesis or predisposition towards allergies. The very foods we eat can cause the same kind of reactions that the pollens that we breathe in if we have allergies. And it causes the release of histamine, which causes vasoconstriction of the arteries. And so people can have high blood pressure and irregular heartbeats from common foods like wheat or corn or egg or milk or yeast or soybean, which are in all the fast foods. Mercury toxicity can lead to high blood pressure, and environmental toxins, high blood pressure. And those are the We got toxins in the foods we eat. We put pesticides on our foods in the field, and we have insecticides, and all these are petrochemical products that get into our system. And if we just took a biopsy of the fat of anybody in this room and we send it to a lab, we'd find it loaded with all kinds of petrochemical products, which have adverse effect on our health. And pharmaceutical drugs as well. One particularly is hydrochlorothiazide that can lead to high blood pressure. And what are the diseases caused by high blood pressure? Well, you get strokes, you get heart disease, heart attacks, you get heart failure. You get aneurysms where you get ballooning of the arteries. You get aneurysms in the brain where they balloon and blow up and explode, and aneurysms in your aorta and other arteries in your body. Kidney failure, and of course you have a decreased life expectancy when you have high blood pressure, when you're overweight, you have a decreased life expectancy.